T2 Central African Time. It is here on Rise and Shine. Good morning. Let's talk Breast Cancer Month now, as October marks Breast Cancer Awareness Month. The World Health Organization says that breast cancer is the most commonly diagnosed cancer among women worldwide. In 2022, approximately 2.3 million women were diagnosed, and another 670,000 died from the disease. According to the World Health Organization, this year's theme, Every Story is Unique, Every Journey Matters, is a reminder that breast cancer touches the lives of women and their families around the world differently, and that every journey deserves compassion, dignity, and support. To talk to us further about breast cancer, we're joined on the line by Dr. Fatima Hoosain, a specialist surgeon in breast health, thyroid health, and breast cancer here in South Africa. Dr. Hoosain, thank you for making time. Good morning.
Good morning, and how are you today?
I'm well, thanks. How are you?
I'm well, thank you. Thank you for having us
It,
today.
it's our pleasure. Doctor, in 2022, let's start here. The World Health Organization revealed that breast cancer caused an estimated 670,000 deaths globally. What is lacking when it comes to South Africa, according to your expertise? Is it information? Is it ignorance? Is it the failure of our health systems? What is it?
I think it's all of the above, and additional fear and stigma that's associated with having a disease in general. We don't have enough screening available for the populations in general to allow for the what the World Health Organization recommendation, which is annual mammography for all women over the age of 40. That's just simply not available. Education, definitely, women don't know about the monthly breast self-examination, and even if they do, they are often very afraid to do the examination, because what happens if they find a lump? I think there's a lot of misinformation that um, all lumps are breast cancer, and if the lump is breast cancer, it's automatically a terminal diagnosis, which is obviously not true, and in fact impedes the the desire or how people access the healthcare system, and often results in them accessing it too late.
How are we doing as far as diagnosis in the country? I know you talk about not enough screening and not enough self education on self examination. So, how's our screening? How is our diagnosis levels?
We in the rural population, or the vast majority of South Africans who don't have access to screening, we are diagnosing breast cancer in the more advanced stages, so more locally advanced breast cancer, stage 2 and stage 3 disease, and obviously the more advanced the breast cancer is diagnosed at, the prognosis obviously worsens. The risk of recurrence is higher. The requirement for more aggressive therapy is higher, which then perpetuates the fear and stigma that is associated with breast cancer, and the fear of, again, accessing the healthcare system at an early stage, and then trying to examine the breasts, again, self-examination. It's actually a self-perpetuating negative cycle. I think we're not doing too bad given the circumstances. Patients have to diagnose themselves. I mean, they have to feel a mass before they have to. Once they feel a mass, they obviously know there's a problem. Then they access the healthcare system, and then the whole thing gets triggered: the mammogram, the ultrasound, biopsy, etc. So, given that circumstance, I don't think we're doing too badly in terms of diagnosing disease. And obviously, the treatment that we have available, we're lucky. We do have many options for treatment, and there are obviously delays, but delays are not as bad as they are in many other African countries.
And you touched on rural women there in terms of the challenges they're facing, especially when it comes to diagnosis. A 2023 study by Mangosuthu University of Technology and the Durban University of Technology showed that rural women battling cancer suffer from various socio-cultural interpretations of cancer. What other stereotypes are there, and what can be done to change these?
I think there's some people. I mean, there's a lot of belief that if you have develop a cancer or develop any sorts of disease, that this is some sort of curse
Mm.
or witchcraft or something along those lines. And people often, instead of going directly to access the healthcare system, get your mammogram, the conventional system, they try alternative options, which then further delays the diagnosis. And again, all of these things eventually result in a poorer prognosis. The longer you will wait to provide treatment, or the correct treatment, the poorer the outcome for the patient. But that said, I mean, in terms of the rural healthcare system and the rural population, they have a lot more challenges. A lot of those patients are already living on the breadline. Once they feel a mass, even if they wanted to access the healthcare system, it's about financial issues. They have to save money to get transport. They get the transport to make an appointment at the clinic to get seen. Once they get seen, they have to wait for the biopsy to be done. They have to wait for the results. All of these things require another appointment and additional finances, um, which um, which patients often do not have, and obviously hampers their ability to access treatment early enough and often enough. To get the treatment that they need. And the healthcare system, as we know, is overburdened already. So, if I- you know getting them into the system, it takes a long time. Everything takes a little bit longer than what we would hope for.
On the parts that we are doing well as a country when it comes to diagnosis, what can that be attributed to so that we speed efforts up on that part?
I think what we're doing right now, this conversation, having these conversations more often, and increasing awareness, trying to make the idea of breast self-examination a little bit more palpable, teaching people about the realities of breast cancer, that it's a common disease, that it affects a lot of people, that it's extremely treatable, especially if it's diagnosed early, that they don't have to necessarily fear the healthcare system, and fear the implications of getting treatment. I mean, getting treatment does involve some unpleasantness, but ultimately it's to help you. Trying to get those messages across and encouraging those conversations in an environment that avoids stigma. Those are all very, very important. And I think as South Africans, we are doing that, as more and more people are moving from rural environments to the city. These things are becoming, the awareness about it, and correct misinformation is about these discussions are getting much less, and this is very important, because those messages eventually get translated to the populations, which we perhaps are not necessarily reaching in the more cosmopolitan areas of the country.
So, for this year's Breast Cancer Awareness Month, what should we be focusing on?
I think we should be focusing on things that actually we can change, and that is, we should be encouraging breast self-examination. We should be encouraging having conversations about breast cancer. We should be encouraging people to understand that there is treatment available, especially if you get if you get diagnosed earlier. So accessing the healthcare system early is not a bad thing. And if you we health the healthcare environment, the environment that we work in, is not opposed to the to let's say the homeopathic route. So if you want to combine both, there's a lot of I mean, having that conversation with your healthcare provider can allow you to still have your the best of both worlds, get the treatment in the conventional sector as well as see your naturopath or your healer, etc. It just needs both people or both systems to work together and have less hide we shouldn't hide information from each
Right.
other. We should work with the patient and for the patient.
Dr. Hoosain, thank you so much again for educating us, and we appreciate your time.
Thank you very much, and thank you for having this conversation.
Pleasure. Dr. Fatima Hoosain, a specialist surgeon in breast health, thyroid health, and breast cancer, speaking to us on the line about Breast Cancer Awareness Month. It is this month of October.
Start your day right.